Hi, this is Amy, aka Phoenix Rising. I just wanted to update you on everything that's been going on. For a while now, I've been waiting for the footage from my surgery to get here, and so that's where I'm at right now. I did get it. I did get the footage, so I'm going to show it to you today. I also have pictures of a couple pictures before and several pictures afterwards of my surgery. And so what I wanted to talk about today was the before, middle, and after of the surgery, and then show you after that a clip of them turning on the device, and then I'll show you what my head looks like now because it's been 6 months and I'm sure you want to know. So yeah, let's get started. So this is me right before my MRI. This was the second time I had to have an MRI because the first time they didn't do the protocol right or something for the surgeon. This is me at the surgical pre-admission, just kind of a fun picture of me. This is me just waiting until they take me into surgery. They got me all hooked up on the IVs and everything that they need. This next part is where they wake me up during the surgery and they turn on the device for a short amount of time and test it out to make sure they have it in the right place. So they ask me some questions and the sound quality isn't that good. Hopefully you can hear it because we didn't have phones on all of us, so enjoy.
So now we're going to start doing some test stimulation. Okay. We're at 2 volts, 90 per second, 130 hertz. So how's your mood right now? 0 to 10. How about your anxiety? A little less? Okay, so maybe a 2. Okay, any improvement in your energy or any change there?
A little more awake.
Okay, and that might just be the anesthesia, we'll see.
Yeah.
Okay, I'm going to go to 4 volts now. Okay, we're at 4 volts. How would you rate your mood right now? Still neutral or any change? Okay. Yeah. Got some flashing. Good. Good sign there. Okay. Any change in your anxiety? How anxious do you feel right now?
Like a 2 or 3.
Okay. So how would you rate your energy level?
I probably just put in the middle, like 5.
A 5. Okay. I'm going to go up to 6 volts now. Okay. Right. Definitely seeing some increased humor and increased talkativeness. Okay. How about your anxiety right now? Any increase in anxiety, or do you still feel like it's pretty low?
A little bit of increase. Like a 5 out of 10.
So it's increased now, 5 out of 10. Okay. And what is that anxiety like? Are you feeling jittery throughout your body, racing thoughts?
Kind of just jittery all over.
Okay. I'm going to go to 4 volts now. You notice any change? How would you rate your mood now? Feeling a little less chipper maybe?
A little bit.
Okay. Where's that anxiety on a 0 to 10 scale?
Maybe like a 4 or 5.
Okay.
You're giving us great information.
Yeah.
This is exactly what we need. Everything's going perfect.
Okay.
We're seeing some good stuff from our perspective, okay?
Okay.
All right.
Looks like
Check. Amy, are you still awake for me?
Yeah.
Okay, great. So, just like before, if you can remember, I want you to rate your mood for me. 0 is horribly sad and depressed. 10 is extremely happy.
I would say like 5.
So kind of neutral mood.
Yeah.
How about anxiety?
Maybe like 2.
And how about energy level? You feel pretty sleepy?
Still a little sleepy, yeah.
Okay. Alright, so we're going to try some stimulation. How would you rate your mood?
My mood would be, kind of neutral.
Still about a 5 maybe? Okay. And how's your energy level?
Energy level's a little better.
Okay. Where'd you put it?
Probably like, I don't know.
Take a
Kind
step.
of just like want to like stretch, like.
Okay, a little bit more smile now. I'm going to go to 4 volts.
I feel more alert right now
Yeah, increased
than I
alertness.
was a second ago.
Okay. How about mood?
Mood. I feel more positive.
Okay. Do you want to call that a 6?
Yeah.
Alright. I'm also seeing some increased facial expression. I'm going to go to 6 volts now. How you doing there?
I feel a little more awake.
You seem much more awake there.
Yeah.
Right.
Yeah.
Yeah. Obvious smile. How would you rate your mood now?
Probably like a 6 again.
Okay.
Maybe. Yeah.
And how about anxiety?
Anxiety seems to be a little better.
You did great, so are you ready to be done?
Yeah.
Okay, so we're gonna get you a little more sleepy, we're gonna close everything up now, and then when you wake up, we'll be done.
Okay.
Alright, you did great.
So here I am coming out of surgery. Here I am waking up kind of for the first time, and my mom got me a little frog. It's really cute. So here's a picture of my wounds on the top of my head. It's kind of gross, but it is what it is. Here's another top view. It's not as good as the other one. This is the right side of my head. You can't really see it very well because my hair's in the way. This is the left side of my head. It's a little farther out from where they shaved the border. You can really see the staples in this one. They use staples instead of stitches because the stitches are more likely to pull out in the head. Here's another view of the left side, just a little bit farther away. So I had to shower before the second part of the surgery, which was a week later from this surgery. And this is what it looks like when it's all cleaned up. This was a couple days after the second surgery, which is where the pulse generator and the battery is. This is a side view. You can see there's a little bit of a bump there. This is above my left ear, and this is where they connected the probes in my brain to the battery pack. Here's another picture of the wound behind my ear. This is several days later when some of the stuff flaked off. So this next video is them taking the staples out of my head. If it's gross to you, you can skip ahead. And yeah, enjoy. Started it.
I'm not getting your face in this. So. that hurt?
A little bit.
Sorry.
This feels like someone's like yanking on your hair a little bit.
Actually,
It's the one behind my ear that hurt the most.
Mm-hmm.
But once you got past like the first couple of staples, it didn't hurt as bad. It was just like that lower part that was the worst.
Can't really imagine that leaving him in would be a good thing, though. Eventually, it wouldn't be a good thing, right?
No, yeah.
Starting to scab up a little bit, or
No, it doesn't look like anything abnormal.
good.
Any of the swelling around your incision should start going away in the next couple days. That might be kind of a slower process, but.
This looked pretty clean.
Mm-hmm.
Didn't notice any redness there till this now. Before.
And this just looks like skin irritation from the.
Well, I didn't know if she should wear that headband or not, but with the staples, but
I probably wouldn't wear it at home, so you can let your incisions
Yeah.
breathe.
she only.
I
put
just
it on 'cause
just
she
wore it
was
today
going out.
because
Yeah.
I didn't want to freak people out as I'm walking down the street.
And I think it's okay when for a short period. Not wear it too tightly.
Is it tight? Your headband, Amy?
No, it's not too tight. I think the more I wear it, the more it will stretch out.
You could try stretching it out a little bit with your hands. More.
So this is what it looks like underneath the bandage. It had a clear plastic piece on top of the glue. They just use glue and underneath stitches. Here's the side view of what it looks like. You can see there's a slight bump underneath the skin. Now that the healing has happened, you can barely tell there's a bump there. This is a little bit of a blurry picture of what it looks like after all the glue came off and the plastic thing came off. So we're on our way to turn on the device, and I'm pretty excited. We're gonna find out how to use the device they gave me in case I need to turn it off too. Hopefully we'll get some footage of that. You can see my hair has grown quite a bit in the past month, and everything's healing up good, so yeah, see you in a little bit. So this is the University Neuropsychiatric Institute. This is where I got my device turned on and visited there many times afterwards. This next clip is with Dr. Kaez. He's been doing my adjustments on my device, and this is the first time that we had it turned on. It's a pretty long process. It was like an hour, maybe an hour and a half-ish. I only show a couple clips, but if you guys really want me to put the whole hour on, I can. So, yeah, there we go. Enjoy.
Looks like it's working on connecting. Okay, we are connecting.
Sweet.
There they're just shaking hands with each other right now.
That's just funny.
It takes a while, doesn't it? It's kind of surprising. That last 2%, yeah. Okay, so we're gonna now let the device go through some automatic measurement of the impedance to see whether the leads are positioned properly and whether they're functioning, okay?
Okay.
So you might feel some sensations,
Okay.
buzzing, other things. If you do, let me know, okay? If it gets really uncomfortable, we can just
Okay.
stop.
I don't feel anything yet.
It might. And Amy, if at any point you need a break, you need to go to the bathroom, anything like that, just let me know. Okay. You end up like in an emergency department, or you're seeing somebody else and they need to interact with the DBS, or they have to interrogate it in some way, then they should be able to find my pager number in the information about the stimulator, okay? And they can get in touch with me if they have questions. So we need to move you.
Yeah, I think I might have moved it when I was
There we go.
my phone
Okay.
on my purse.
Will begin at 4 p.m. in classroom D.
All right, so now we're gonna start to do some stimulation. Okay.
Yay.
So it's all connecting, huh?
Mm-hmm. It's all working the way it should. Okay, so we should be on. All right, so I'm going to start off really, really low. We're going to go up by about 0.5 volts every time we change parameters. We'll give you a little bit of time to check in and let me know if you're feeling anything, see how your mood and energy and so forth are changing. And once we get to a point where we feel like there's a very significant response in terms of your mood and how you're doing, I'm going to back down on the voltage a little bit, and then we're going to send you on your way.
Okay.
Okay? All right.
How do you know which places on the probe you want to activate just from
Well,
your testing before?
from the testing we did interoperatively and from the imaging that Kara and Dr. Ralston did.
Great.
And just give me a number. Where would you put your mood right now? 0 to 10, 10 being exquisitely good, 0 being you wish you were dead.
Maybe like a 6.
Okay.
Not like.
And how's your anxiety? 10 being the most severe anxiety you've ever felt, 0 being none at all.
I'd probably say it's like a 4.
Okay. And energy level, 10 being you're signing up for the marathon, 0 being you want to fall asleep right away.
Probably a 4.
Okay, great. All right. Okay, so here we go. Noticing anything at all?
Kind of seems the same.
Good.
Is, are you activating both sides right now?
We're
or
just doing the
one
left side right now.
Okay.
I'm going to go pretty quickly at the low voltages, all right, and then once we get to the higher voltages, we'll move a little bit more slowly. Okay, how you doing?
Tiredness is the same. Anxiety is probably a 3. Mood, probably like a point higher, so like 6. Was it 6? Yeah.
Okay.
That's a little better.
Any side effects that you're seeing?
Not really.
Okay. How are you feeling now?
Trying to decide.
About side effects, anything that you're noticing is concerning? Funny taste, pulling sensation in your mouth, funny smells, flashes of light, seeing little pink elephants or anything like that? Okay.
My mood is probably maybe a little down.
Okay.
From, I don't know, at the very beginning, I kind of felt, and I felt this before, like, kind of like a warm feeling that kind of goes through my face and like my chest, usually when I have anxiety.
Mm-hmm.
Or like sometimes, well, a lot of times I'll feel it like when I have like an immediate like anxiety like issue pop up, but it came over pretty quick and went away, so I don't know if that's just me.
What about stomach issues that go along with
The stomach's probably probably like a 3 still, 3 or 2.
So with the anxiety, you mean?
Yeah.
Okay.
3.
And mood? Sorry, could you rate your mood again?
My mood. I don't know, I'm just kind of like feeling kind of like a 5 or a 6 right now.
So
just
kind of meh.
Yeah.
Okay. Energy?
Energy. Probably like a 4.
So a little less.
Yeah.
Okay. All right.
So as you can see, all that stuff was kind of crazy, but you know, I think it's really helped me now that I've been doing therapy for about 7 weeks now. And if you see these pictures behind me on the walls, that's part of my therapy. Yeah. So, I mean, I really think that the device has helped me with my OCD, especially when I do my exposures, because there isn't as much anxiety as there used to be when I did therapy, exposure response therapy. And so me and my counselor have talked about this, and then we talked to my neuropsychiatrist, and he thinks that, yeah, it is the device that's keeping me from having a lot of anxiety. So now what we're dealing with is the disgust My issue is disgust. I am disgusted by the item that I am disgusted by. And it's frustrating this time around because I don't have as much anxiety. So do the exposures, there's not much anxiety. And so we go by the disgust as well as the anxiety. It's been really great though. I mean, it's been hard to have not much anxiety because every time before that I did therapy, I always had a bunch of anxiety attached with it, and now I don't. So yeah, it's really good. Oh, another thing I wanted to show you is my hair growth from 6 months ago is, yeah, it's kind of crazy. It's kind of caught up with my other hair though. Yeah, so I mean, it's not that bad. I mean, I do have to cover up my head once in a while because my hair does like to stick up every once in a while. So I mean, it's grown back quite a bit since the surgery. Yeah, and 6 months are up, so that means I can maybe get my hair dyed and colored again. And bleached and colored, so that will be fun. I wish you guys all the luck in the world if you decide to do this for OCD. It has helped me tremendously, and I think it will help anybody that has the surgery. Yeah, so I'll see you later. Bye.